Hello, ladies and gentlemen. I am Dr. NIK NIKAM and welcome to NIK Medical Education. I am a cardiologist from Houston, Texas. The knowledge shared in this presentation is for educational and informational purposes only. It is not a medical advice. Please consult with your physician for any precise medical advice or recommendations. Please do subscribe to our YouTube channel. The topic today is heart attack after a normal checkup. From time and again we hear he had a heart checkup and he was doing fine. How come he had a heart attack? How can someone have a heart attack after his doctor told him that his nuclear stress test was fine and his heart was normal? Well, the fact that the doctor said his nuclear stress test was fine may be accurate, and the fact that he had a heart attack was also accurate. Was his heart normal? That's what we are going to look into. Welcome to the real world. In order to understand how someone can get a heart attack if they were told that their heart was normal, let us look at what causes heart attack to begin with. The heart is supplied by two major arteries, namely the left coronary artery and the right coronary artery. When one of these arteries block off, that area of the heart muscle dies, and that is known as a heart attack. And here is an angiographic depiction of a coronary artery. As you can see here, we have the left main coronary artery, and there is a plaque buildup here which is blocking the artery almost greater than 90%, and there are two major branches supplying the front of the heart muscle, just as we see here. There's also a branch going around the lateral aspect of the left ventricle, supplying the lateral wall of the ventricle. The right coronary artery supplies the right ventricle and the inferior or the lower part of the left heart chamber. In order to have a heart attack, you almost have to have a 100% occlusion of an artery that reduces the blood supply to zero, which leads to the death of that region of the heart muscle, which results in a heart attack. So how can someone have a heart attack if the doctor said his nuclear stress test was normal? If we look under the microscope, the coronary artery we were talking about, this is how it would look. It has a lumen, and here are the various layers of the artery, and here is the buildup of the plaque. The plaque buildup takes anywhere from 30, 40, 50 years. It begins when we are in our 20s, and slowly the plaque builds up with the collection of cholesterol, calcium, platelets, and it slowly becomes like a mount. When the mount increases, there is narrowing of the lumen. However, if we do a stress test, when the narrowing is less than 70%, the stress test may not show any evidence of reduced circulation. In the later stages, there can be an issue with the cap of this plaque sometimes rupturing. And here's an example. If we do a stress test, when the artery is less than 70% blocked, the images may look normal during rest and exercise, and your doctor may say, well, your heart is normal. But that doesn't say whether you have a less than 70% blockage. That's where the real story begins. When you have less than 70% blockage, if the cap of the plaque becomes vulnerable, becomes thin, and it ruptures, it becomes like a volcano. And all that material that is pouring out of the plaque becomes highly hostile to the environment within the artery, which leads to aggregation of platelets and the red blood cells, which very quickly creates a mushroom-like clot which can block the artery. That leads to 100% blockage, which eventually will lead to a heart attack. So this is very similar to a concept of a rupture of a plaque, like we see in a volcano. And we are beginning to understand the nature of the plaque and why they rupture, but we don't have the in-depth knowledge about how we can really modify the plaque so that the cap is more stable. If you review the medical literature, this is not uncommon. More than 40% of the people who have heart attack have less than 50%, that should be 50% blockage. And I talked about the concept of vulnerable plaque, where the capsule may become thin and it may rupture, leading to a sequence of events that can cause a blood clot to be formed, which can totally block the artery, leading to a major heart attack. Again, none of the tests, including angiograms, are 100% accurate. Even if we had done an angiogram and we saw less than 70% blockage, we would not know if the plaque was vulnerable or not. There are some highly advanced technical studies which can look at the plaque and the plaque covering and look for evidence for an unstable plaque, but that is not something that we can use in our everyday medical practice. However, you need to focus on vigorously reducing the risk factors like hypertension, weight, smoking, sugar and cholesterol levels, and increasing physical activity. By doing these things, by reducing the risk factors, we may be able to reduce the rate of progression of the plaque and indirectly maybe reduce the chances of plaque rupture. So this is a brief description of how someone can have a normal cardiac examination as such and can still be at a risk for a heart attack. If you want us to create an educational video on any other topic, please leave us a message. We'll be glad to create a video explaining things in a simpler manner. And you can also look at our books, Heart Healthy Lifestyle, Stress-Free Lifestyle, and you can also get some laughter. Laughter is the best medicine. You can look at Nick's comedy clips. Please do subscribe to our YouTube channel and stay tuned for our next medical education presentation. I am Dr. NIK NIKAM. Thank you so much for your time.